There we go.
Okay. Can you see it? Is
So
it
I
good?
just want to tell you, yes, just Jennifer Kucera. She is on staff with the Center for Disability Empowerment. She resides in the Cleveland area, but of course, everything is virtual these days. She comes with a wealth of knowledge and experience. So Jennifer, I'll go ahead and let you introduce yourself.
Okay. Thank you so much, Deb.
Mhm.
Um, as Deb said, my name is Jennifer Kucera. I'm actually a person with a disability. I was born with a form of muscular dystrophy. And I have, in my life, I've been a math tutor and teacher, and always an advocate for rights of people with disabilities, first starting with myself as a self advocate. And then when I actually turned 50, not so very long ago, I decided to become a systems advocate full time. And as Deb mentioned, I do work with her at the Center for Disability Empowerment as their healthcare outreach coordinator. Um, some of the other advocacy that I do around the state, I'm currently the chair of the Ohio Olmstead Task Force. I'm also the chair of Ohio's DD Council, which gives grants to people within the state and outside of the state to begin programs that service people with developmental disabilities. The work I do on Olmstead has to do with people with disabilities living within the community. So we do all kinds of advocacy work to make that occur. Most of the advocacy I do is surrounding our medical system, but I've also done work on housing, voting rights. Um, I'm also a member of the United Healthcare National Advisory Board, where we talk about self-direction and Medicaid. So you will see me in a lot of spaces within our state. And tonight I'm here to kind of give you an overview and I guess a little bit of everything about Medicare and Medicaid. If even if you are just a beginner in this space and know nothing, I will hopefully provide you with a level. If you are more of an expert, I will give you something for that as well. Um, there's going to be a lot of information. And if you have any questions in the midst of my presentation, feel free to raise your hand. I don't know if I'll be able to see you on the Zoom screen, but you can raise your hand. Deb can, you can even type your question in the chat. And Deb, I think, is going to be monitoring that, and she'll call on you if you do raise your hand. All right, so without further ado, I'm going to start, excuse me, talking a little bit about Medicare, and there's a reason why I am doing so, and you'll see that as we progress here. Medicare, and a lot of people get Medicare and Medicaid confused. Medicare is a federal health insurance program for anybody age 65 and older, and some people that are under 65 with certain disabilities and conditions. It doesn't have an eligible income eligibility requirement like you will see that Medicaid does. Medicare is funded and administered by the federal government. So again, people that are 65 and older are eligible for Medicare. If you are a U.S. citizen or if you've been a legal resident of the United States for 5 years, you also are eligible. If you are under 65, you can still receive Medicare. And you actually can automatically receive Medicare if you're under 65 if you receive Social Security Disability Benefits, or SSDI, for 24 months or longer, or you have the two disabilities that I named there, the end stage renal disease or Lou Gehrig's disease, or ALS. Now, if you are 65 years and older and you do receive some sort of Social Security, SSDI, like I mentioned, you will automatically be enrolled in Medicare if you're 65 and older. But if you are not getting Social Security benefits, then you do have to apply for Medicare. I'm not going to read everything on the slides. Deb will send the slides out after this presentation. So some of the things that I don't read, you'll still have, a reference to the material. Now you can apply for Medicare online, by phone, through your Social Security office. And it's actually 3 months prior to you turning 65 or 3 months after you turn 65. And if you don't do it then there's actually a penalty that you have to possibly pay if you enroll at any other time. Now, the parts of Medicare, I'm just briefly touching on these: Part A, Part B, and Part D, which is drug coverage. And there's also Part C, that is where your Medicare Advantage plans. So if you watch TV, especially late at night, you're going to see all those advertisements for certain companies offering these Medicare Advantage plans, and there's a ton of them. And they are usually private companies that bundle other Medicare parts together, and they might possibly even offer some extras, transportation, or even some medical supplies. So again, that's what they're talking about when you see that on television. Now, Medicare, again, as I mentioned, it has different parts. Part A is really the hospital insurance. It covers your inpatient stays, some level of nursing home stay, some home health care, but very little. Part B is your medical insurance. So it covers your doctor visits, some, again, home health care, some durable medical equipment. But I must mention that even for nursing home stays, it's very short term. It's if you say injured yourself or you had to get surgery and we're only in the hospital for a short period of time where you are going to recover and be able to return to wherever you lived prior to the skilled stay. The same thing with home care. They do offer home care through Medicare, but again, it's usually for those situations where you just might need a little bit of help for a short period of time, and they assume that you're going to get better and be able to continue living within the community without any help of home care. Now, what if you need longer caregiving services? If you become injured or disabled and it's not going to improve, and you need the help of caregivers in your home, well, the only payer, this is why I mentioned about Medicare, the only payer of long-term caregiving services is Medicaid. So again, if you need care for a long time, you're going to want to apply for Medicaid. So the only payers of long-term services and supports is either private pay, where you pay out of your own pocket, or through Medicaid. So let's switch gears a little bit and talk about Medicaid. Medicaid is a public health insurance, provides healthcare coverage to low-income families. So there is a financial requirement that you have to meet in order to qualify for Medicaid. And since I like history, this document that you see before you is actually the original document creating the Medicaid program. And does anybody know who that president is that's pictured there, for any history buffs out there?
Lyndon Johnson.
Very good. Good job. Yes. Lyndon Johnson, he became president after Kennedy, and that occurred. The Medicaid and Medicare programs began in 1965. They were enacted over title, see if my Roman numerals are up to speed, title, what is that, 14? Yes, I think so. 14 of the Social Security Act, and President Lyndon Johnson signed them into law. So that's both for Medicaid and Medicare. So again, Medicaid provides healthcare coverage for eligible lower income adults, children, pregnant women, older adults, along with people with disabilities. It is funded 70% by the federal government and 30% by the state governments. And the amount of, and this differs per state as well. So they calculate this out by, there's a huge formula, and it's based on what they call the FMAP. And that determines how much money the federal government rather, provides to the states to run their Medicaid programs. So every state can be different. And the states can decide what services they want to include or not include. So the states get to do that, but the federal government helps out each state. Currently, well, in actually 2023, 30% of all Ohioans were enrolled in Medicaid. And 40% of Ohio's entire budget, the entire budget for the state, is spent on Medicaid as of the latest numbers. So Medicaid is a fairly large program within our state. And some of these things I have simplified. They're still accurate, but they're simplifications for ease of understanding. So to be eligible for Medicaid, you have to be in Ohio at least. You have to be an Ohio resident. You either have or you applied for your Social Security number. Be either a U.S. citizen or you meet non-U.S. citizenship requirements. And again, because it's Medicaid, there's a financial requirement. So there's a range of money that you can make per month to qualify for Medicaid. And there are also numerous Medicaid programs within our state, and I've actually listed a few, but there's a lot more than that. And that link that you will get does connect you to all the programs of Medicaid in our state. So some of the ones that I'm really not going to talk about are the Healthy Families Program, Healthy Start Program, Ohio Rise, Youth Aged Out of Foster Care. Now, all of these, again, because they're Medicaid, have a financial component, but they're all geared towards different populations of folks. So if you end up going to this site, you will find out the eligibility requirement and the description of each of these programs that I've listed and more.
I have a question, Jennifer. On the, they need to be an Ohio resident. Does that, I can't remember in Ohio what that means. Does it mean at least 1 month living here or 2 months? Is there a timeline?
That's a very good
Someone to be
question. I'm sure
eligible?
there is, but I'm not going to lie. I'm not mixing something up. I am not 100% certain. So I
Okay.
don't know if somebody else in the audience might know that.
I'll look for it.
Okay, thank you. Sorry about that, Deb. Good question. And I can always find the answer out for you. Absolutely. So please don't be afraid of asking questions, because either I can find out or I hopefully will know. So I'm sorry about that one. Okay, so some ways, not all the ways, to enroll or apply for Ohio's Medicaid program. The first step really is to research what program you might be interested in. Again, this is optional. You could go to that web source that I stated in the last slide and see all the different Medicaid programs available and select which one might be of interest to you. But you can also just complete an application, and possibly based on your answers to the application, they can kind of sort out what program you might be eligible for as well. So there's numerous ways to apply. Now, this is just for Medicaid, straight Medicaid, no waiver, just the traditional Medicaid. You can either apply online, and there's a link there where you submit all your documentation and the application online. You could apply in person or by mail, and this goes through your local county job and family services office. So the applications all go through that office first, and then they travel over to the Ohio Department of Medicaid, but they start at Job and Family Services. And you can also call if you have questions or any concerns, you want to fill out the application. You can also call the consumer hotline that I have listed there. Besides that, there are other areas and sources that can help you in either completing an application or answering questions. So some of those resources, again, that I have listed here are your local JFS office, the consumer hotline, one of your centers for independent living, like we are, where me and Deb work, your area agency on aging, which I'll talk about a little bit later, your local county boards or boards of IDD. Even some communities have a community department within your city that can help fill out Medicaid applications. And sometimes your local libraries, they usually have the applications, and they may possibly be able to assist you as well. So along with filling out this application, you have to provide support documentation depending upon the program that you are interested in Medicaid. And some of the standards are the proof of income, because remember, there's a financial requirement to Medicaid. You have to list, show your resources, whether it's a savings account, checking account, whether you own a house, if you rent, if you have stocks, bonds. You have to show proof of citizenship or alien status. If you're applying for a pregnancy program, then of course you have to prove that you are pregnant. Provide other medical insurance you might have. And if you are applying because of age or disability, then you will have to show proof of your age and or disability. Of course, you sign the application and you submit it along with all your support documentation. And again, you want to get it to the JFS office. So either by mail, by fax. If you do it online, it'll go right to your JFS office. And again, this is for traditional Medicaid. Okay, so again, certain, so say there's certain populations of people within our state and you're enrolled. So if you are age 65 or older, and again, Medicaid assumes that you have a financial, a level of finances within the acceptable realm on Medicaid. And again, you can find that online, and some of the links I provide later do show you to the site where that is located. And there are different requirements depending on the programs. So say you're either age 65 or older, you have a physical disability, maybe you're an adult or you're a child with a developmental disability, or if you are what's considered a medically fragile person, you have some options. And the questions are, do you want to live within your community, or would you rather live in an institution like a nursing home, assisted living facility, or an ICF or intermediate care facility? Now, let me go, I don't know if I can go back, but if you wanted to live in an institution, then having traditional Medicaid, you would be covered to go and live in, say, a long-term care facility. You could stay unlimited amount of time, and there may or may not be amount of money that you have to pay depending on what Medicaid you have. So I can't make a blanket statement that it wouldn't cost you anything to live in a facility. So I'm going to go through a couple different scenarios here. Then we're going to talk about waivers. Scenario number one, Jane is 68 years old. She has Medicare because she's over 65. She also has trouble walking. She's fallen down a lot. She needs assistance with what we call the ADLs, activities of daily living, such as bathing, dressing. She currently lives by herself and she doesn't have any family that she can live with and help her out. She lives in an apartment that's rented. She has applied and she's also enrolled in traditional Medicaid. So her choices, and again, I'm simplifying this. A couple of her choices are, she can decide to live in a nursing facility long-term. And again, traditional Medicaid that she already has will pay for some or possibly all of her nursing home costs. And she, with traditional Medicaid, could remain in the nursing facility as long as she wants to, and it will be covered. Here's another scenario. Miley, who is 45 years old. She was involved in an accident and now has a spinal cord injury, which she did get when she turned 45. She cannot walk. She uses a wheelchair to assist. She needs help with, again, her ADLs like bathing, dressing, transferring, etc. She currently does reside in a nursing home, but she wants to live in the community. And she has applied for and is enrolled in traditional Medicaid. Now, before 1981, because in 1981, states began creating this idea of Medicaid waivers. Prior to 1981,
you can't go outside. No,
Only,
you have issues.
Jane Marie, can you just mute, please? Thank you. In before 1981, her only recourse would have been to either live with family and family takes care of her, or to reside in a nursing home, because Medicaid back then, Medicaid's only they only had to pay for long-term services and supports in institutions. And if you know anything about the disability independent living movement, in 1987 is when I think the last institution that housed people with mental illness or disabilities closed. And that actually was the same year that I graduated from high school. So it was a long time ago, but not really in the grand scheme of things. So in 1981, that's when this idea of Medicaid waivers began. So Miley now has an option of moving or staying in the institution or moving out into the community. And there were other, if you're interested in learning more about the independent living movement, feel free to get a hold of me, but there are other things that made living in the community possible, like the Olmstead Act that was signed into law in 1999. That also helped people not to live in institutions anymore. So the idea of Medicaid waivers is one that helps people to get long-term services and supports within the community. It gives people with disabilities options. So what exactly?
Jennifer,
Yes,
can I ask a question?
absolutely.
So Miley, you said that she was in the car accident at the age of 45 or whatever, so she wouldn't qualify for a waiver because her disability was not onset before 22, correct?
No, she would, because what you're talking about right there is a developmental disability level of care waiver, which we're going to talk about in a moment. She
Got
would
it.
qualify for nursing home level of care waivers.
Got it. Thank you.
Yep. So what are waivers exactly? I was always wondering that. Well, waivers are actually a way to get around Medicaid laws. And I'm going to say this in several different ways on the slide. I'm not going to read them all, but Medicaid laws can actually be waived. And this helps states to explore new ways of giving or delivering Medicaid to different populations of people. And it also gives a way for different payment models to be created to offer long-term services and supports within the community. So it's kind of a workaround for the different laws, just to explain it simply, a workaround for some of the state statutes and the state laws. It's obviously more complicated than that, but in essence, that's what it means. So Medicaid is allowed to create these waivers to offer specialized benefit packages, and they can choose an actual subset or smaller group of people that are eligible for traditional Medicaid and offer coverage that wouldn't necessarily maybe be allowed if they just followed traditional Medicaid rules and laws. Again, Medicaid only covered long-term services and supports. That was before waivers, that was the thing. They would only cover institutional living. So you could either reside in an intermediate care facility, and ICFs began in 1971. You could reside in nursing homes, and I'm not even sure nursing homes have been for a lot longer than that. You could live in a group home or another institution, but not within the community until these waivers began in 1981. So there's some requirements for states being able to create waivers. There's a state wideness requirement. So normally in traditional Medicaid, it has to cover the entire state to be allowed, but this is one of those workarounds, some of the laws. With these waivers, they could target a certain area in Ohio if they wanted to. Like they could target Northeast Ohio and just offer a waiver program for people in Northeast Ohio. Again, it's a little bit more complicated than that, but they don't have to have this state wideness requirement in order to create a certain waiver. There's also comparability of services requirement. So they can, again, take a smaller set of everybody eligible for Medicaid and offer a waiver to them. So, for example, and I'm going to make this silly, everybody say there's a group of people on Medicaid that only wear black and white striped shirts. So they could create a waiver for those people that have Medicaid that wear black and white striped shirts. So that would be an example of comparability of services. There's also an income and resource rule requirement. So, you know, I've been saying that there's a financial requirement to being able to be eligible for traditional Medicaid. Well, they can change those rules a little bit when they offer and create a waiver. So for example, say you are a parent and you have a child with a developmental disability, but say you and your husband both work and you make $300,000 a year. It's a possibility that your child could still qualify for that Medicaid waiver because they change the financial requirement with certain waivers. Not all of them, but the financial amounts are different based on a waiver. So it wouldn't follow that traditional low income Medicaid rule necessarily. So
Jennifer,
it's
can
more-
I ask you a question?
yes.
On top there, it says HCBS waivers. What does that abbreviation stand for?
Thank you for asking. So these waivers are for home and community-based services, which is
Okay.
what HCBS. So these are the ones that are going to allow you to remain in your home and not in an institution. These waivers are also, right down at the bottom, they are called 1915C waivers. So it's kind of like the same name. You might hear HCBS, 1915C waivers. It's all meaning the same thing. It's waivers that allow you to remain in your home. And 1915C actually refers to part of the Social Security Act.
I have a question, Jennifer.
Yes.
How many waivers are there in Ohio?
I think there's 8 or 9, and we're going to get there momentarily.
Okay.
Okay.
Now's a good time to ask any questions
Sure.
related to what you've seen so far.
I have not looked in the chat, so I don't know if there's anything in the chat.
No, I've been keeping an eye on that.
Okay.
I will remind everybody that this is being recorded and we will send you the PowerPoint. So let's just, allow you to sit back and just listen to the information. Because this is a lot to
There's a lot.
understand.
Okay,
Okay, we
so
can go ahead.
thank you. Okay, so again, I'm going to be redundant in some of my words. Medicaid waivers allow individuals with disabilities, chronic conditions to receive care in their home. So that's why it's called HCBS. And then rather than in hospitals, intermediate care facilities, or nursing homes or long-term care facilities, they're also called. These waivers are also important because they allow, sorry, my dog is very protective of me. Hold on 1 second, please. These waivers also, bye-bye. These waivers allow the individual person to really have more control of their life because they could live within the community instead of residing in an institution. And they obviously you can remain active in your community. And to be eligible for a waiver, you have to have a specific level of care, they call it. And again, because it's a Medicaid waiver program, because it's Medicaid, there's that financial criteria in order to be able to enroll in these waivers. So we're going to talk about some of these levels of care that I mentioned here. So a level of care is actually about a person's physical, mental, social, or emotional status or abilities. And there are two different types of level of care that coincide with different waivers. So there are what we consider nursing home level of care waivers. And those are, that I'm going to talk about today, are the Ohio Home Care Waiver, Passport Waiver, the Assisted Living Waiver, and the My Care Ohio. It's not considered really a waiver yet. It's a program, but sometimes you might hear it be called the Managed Care Waiver, even though technically it's not a waiver. And you, in order to sign up for one of those 4 waivers, you have to have what's called a nursing home level of care. Now, the other level of care is the developmental disability level of care. And there are 3 waivers that the state of Ohio offers for that level of care, which we're going to talk about today: the individual options waiver, level 1 waiver, and the self waiver. Okay, this is where I know it's already complicated, but it gets worse. The nursing home level of care waiver. I'm not going to read all of this because it is very complicated, and there's not really an easy way to explain this. So you have to have what's considered an intermediate level of care or a skilled level of care to qualify for this nursing home level of care waivers. So that means basically the requirements are listed here, but you need to at least need assistance with 2 major life activity levels. So your activities of daily living, like I mentioned before, transferring, moving from, say, wheelchair to bed, washing yourself up, grooming, bathing, mobility. There's a whole list of them. And again, there's sites at the end that direct you exactly to what the activities of daily living are. If you are not able to figure out and administer your own medications, that is also considered, could possibly be considered part of the nursing home level of care. And if you need skilled nursing care, like say you have a trach or a respirator, and the only way that you would be able to survive without services is to reside in a nursing home, because then they, of course, obviously would provide you with the care that you needed. So these waivers, again, you would not be able to survive and remain healthy if you did not reside in an institution. So they're considered, again, I'm simplifying, but the nursing home level of care waivers. Now, like I said, besides that, there are also the group of waivers that need the developmental disability level of care. There are 2 separate classifications for those. So there are different requirements for those people that are age 0 to 9 and those that are 10 and older. And this is where the one person that mentioned the age of 22 comes into play. To be considered having a developmental disability, you need to have that disability prior to the age of 22. And to have a developmental disability level of care, again, I'm not going to read all of this, but some of the things I've highlighted are a substantial development delay that's not based on mental illness alone, and functional limitations, again, help with those ADLs that I mentioned before, like mobility, being able to care for yourself. So without services, are you able to care for yourself is, in a nutshell, again, simplifying, but that's what they're saying. And the same sort of, some differences if you are at age 10 or older. These are complicated, and there are resources that can help you figure this stuff out too. You don't have to determine this on your own. Now, I want to mention my own case briefly, because I would qualify for both. I would qualify myself, and my disability would qualify for nursing home level of care. But I would also qualify under developmental disability level of care since I was born with my disability. So there are some people that do qualify for both because it's very similar criteria. and I will share more of my story here in a moment, just to give you some idea. When I was choosing, I am on a waiver. When I was choosing my waiver, even though I could have chosen a developmental disability level of care and choose one of their waivers, I did not. I chose a waiver that we'll talk about in a little bit from the Ohio Department of Medicaid called the MyCare program. And I could have gone either way, but I chose to get the nursing home level of care waiver. So again, this kind of just states the same thing that other slides have. Again, it's another definition of nursing home level of care. So we're going to talk about the specific, again, this is the specific nursing home level of care waivers. And they are offered through the Ohio Department of Medicaid and the Ohio Department of Aging. So on the right-hand side of the slide are the two that are offered by the Ohio Department of Medicaid. They are the Ohio Home Care Waiver and the MyCare Ohio program, which will be a waiver eventually. Sometimes it's also called the Managed Care Waiver, and that is currently the one that I have. They are both labeled as nursing home level of care waivers. They're funded by Medicaid and they are administered by the Ohio Department of Medicaid. And they are for home and community-based services. So who can apply for the Ohio Home Care Waiver? Again, you have to have a nursing home level of care, be 59 years or younger. Because it's a Medicaid program, you have to have that financial eligibility. So it depends on how much money you make or don't make. And you have to already be receiving Medicaid, because remember, this is like over and above Medicaid. So if you want to get on the home care waiver, one of the things I would suggest is that you could call the 1-800 number I give you there, which is the Ohio Benefits of Long-Term Services and Supports. You could also, again, call your local JFS department. There's a form that's listed there that I'll provide the link to, that actually is an application for the Ohio Home Care Waiver. After you apply for this particular waiver, and with many of the other waivers, the Ohio Department of Medicaid will assign a case management agency to you. And they will come out to conduct what they call a level of care assessment to make sure that you do have a nursing home level of care. And if they deem, there's other factors in there too, but if they say that you do have a nursing home level of care and all the other requirements work out, then you are approved for the particular waiver. And then the next steps, really, they assign you a case manager. The case manager comes out and does an entire functional assessment of your needs. You talk with them about what your wants and needs and desires are, what supports you need in your home of those services that are offered. The case manager helps you to develop a person-centered care plan, and then the case manager helps you to coordinate your services. Again, simplifying a little bit, but in a nutshell, that's kind of how it works. Now, these are some of the services that are available, and I'm not going to read them all here, but pretty much all of the nursing home level of care waivers, more or less, offer the same sort of things. Many similarities between the developmental disability level of waivers. There are some differences between each level of care waiver. Now, if you are on the Ohio Home Care Waiver, down here at the bottom, this website actually, you can log in and it provides you with your care plan and the services that are available. And they're all separate. So this one is the link I provided you down there is only for the Ohio Home Care Waiver, not for any of the other waivers. It's crazy how things are not in alignment and don't all go along. And that's one of the things that, we advocate for. All right, now again, it's a lot. I apologize, but I wanted to give everybody a little bit of something. So hopefully you'll have a couple of takeaways that you can leave today with. MyCare Ohio program. It combines Medicaid and Medicare. It is what we call a managed care program. So it's one of the managed care companies like United Healthcare, or Care Source that run this program. It is actually not across the entire state. So here's where only 29 out of the 88 counties actually have this program. So I know that Central Ohio, Franklin County does not have the MyCare Ohio program. But it is changing. Right now it's what they call a demonstration project, so it's not permanent. They just decided to try this out to see if it
I have a question.
would work. Yes, Heidi.
Is Montgomery County, do they do that? I know you said Franklin County doesn't. Does Montgomery County?
That I would have to look. Montgomery is Dayton.
Yes, Montgomery County's MyCare.
Thank you, Jane Marie.
You're welcome.
I do provide with a map at the end for that to look up. There are some maps that are online that you can find. And thank you for that, Jane Marie. So they started this program in 2012, and they are in the midst of revamping us. Some of us that are on this call are actually involved in the advocacy work. The current version of it expires at the end of 2025. 2026, it will be turned into a waiver, but we don't know at this point if they are going to just keep it to the 29 counties or if it will be spread to more counties. And it's the Ohio Department of Medicaid that administers this program, but it gives money to the MCOs or the managed care companies to run the program. The eligibility, again, is that nursing home level of care. Again, because it's a Medicaid program, financial eligibility, and you have to be 18 or older. And on the right are some services that the MyCare Ohio program provides.
I have a quick question.
Yes.
I'm a little confused when you said it's, so I do have clients that are in Franklin County that have MyCare Ohio. Like on their benefits card, it says that they have Medicaid and Medicare, and it's MyCare Ohio. So are you saying that all of MyCare Ohio is not in Franklin County, or only like a certain part related to the waiver is not in Franklin County? Because I'm a little confused about that.
Yeah, maybe I'm wrong. Maybe it is in Ohio. Yeah, you know what? I take that back. You're right. But not all managed care companies are in Franklin. Yes.
Okay.
Thank you for clarifying that. You
Yeah,
are correct.
Thank you.
Right. Yes, you are right. Franklin does have it, but over there on this slide, over there on the right are all the managed care companies that are involved somewhere in the state, but not all of the care companies are everywhere. So in Franklin, I know United is not in Franklin. I think it's Molina and one other one. I think, I don't want to misspeak. I know it's Molina.
I think
for
it's
sure.
Care Source.
Okay, thank you. And so again, I think one of these links on this page provides you with the map of where and who is in each area within the state. So one of the benefits of having this particular program is that it joins your Medicaid and Medicare together. So you really only have one case manager, you have one care coordinator, one organization that's responsible for, you don't have to know if you need to go to Medicare or Medicaid. You receive one set of communications, mostly. If you get a denial, then you contact your case manager. You don't have to know who to contact and when. So it does offer some ease of access, though not everybody likes the program. And again, if you're more interested in advocacy work surrounding this program or other waivers, feel free to reach out to me and I can help you connect with advocacy organizations that are working to make the waiver system better. All right, now nursing home level of care waivers. I'm going to speed this up a little bit. I'm sorry, but there's a couple that are offered by the Ohio Department of Aging. And those are the passport waiver, which stands for pre-admission screening system, providing options and resources today. It is a nursing home level of care waiver. 65 and older are the people that are eligible for this program. You have to be able to remain safely in your home. And the passport participating agencies are the ones that help to qualify you for the program. And some of those people are AARP, the Area Agencies on Aging, and even the Long-Term Care Ombudsman offers support for the passport program. In order to apply, you have to contact one of those PAAs, like your area agencies on aging. The person or you will undergo a telephone screening. If you get accepted, you will develop a care plan, you'll be assigned a case manager, and then you will be on the passport waiver, again, simplifying. Here are some of the services. Again, case management services are provided through the local area agency on aging. All right, now there's also, I'm not going to talk about this very much because it is the only waiver that we have that is not linked to home and community-based services. In order, you still have to have a nursing home level of care, but this helps you to live in a Medicaid funded assisted living facility. So Medicaid will help pay for this as long as you sign up and live in a Medicaid assisted living facility. All right, turning towards the DOD waivers. Now we switch gears to developmental disability level of care. And these waivers are administered by the Department of Developmental Disabilities and the county boards. There are 3 of them. The level 1 waiver, individual options waiver, and the self waiver. The individual options waiver, I'm just going to go through why you would want to choose each one. This is the biggest, most offered services of any of the DD waivers or IDD waivers. It's the most comprehensive one. This one is the one that offers you the most help at your home, and it offers many different services. And so if you need a lot of assistance, a lot of support, this is the waiver you're going to choose on the developmental disability side. You are given a case manager or an SSA. You receive help through your local county board of IDD. They help to create that individualized plan, which is called an ISP. Here are some of the services that are offered. The ones that are highlighted are the ones, there are more, but these are the ones that are different than the nursing home level of care waivers. Money management, I don't think they offer that in the nursing home level of care waivers. So if you need help in managing your money, that's why the developmental disabilities, they offer different services, some, than the nursing home level of care waivers. The same with employment supports. Another waiver is the level 1 waiver. In this one, for an adult, you can only have services that cost up to $62,000 a year. And this is with the dollar increase that occurred the beginning of this year, 2024. They raised it to $62,000 for an adult, $20,000 less than that for a child. And this waiver is for you if you don't need that many supports and you have family or natural supports to help you. And natural supports are the non-paid help that you might receive. So if you have family, friends, and you don't need that much support, then this might be a waiver for you. Again, it is administered by the Department of Developmental Disabilities through your county board. And these are the services. Again, you'll get these slides. And the last one is the self waiver or self-empowered life funding waiver. This one, again, adds an income. I mean, a max on the amount of paid support they will give you. But this one is the one that you direct yourself. It's called participant directed. And so this waiver, you have to be able to manage your own services. You are in charge of hiring and training the people that are going to give you services, and you manage your budget. So they help you, of course, but if you're an adult, you have $62,000 a max that you can spend on services through this program that you help to budget and figure out who's going to provide you services. So those are kind of the differences of each of the developmental disability level waivers that we offer in Ohio. And again, these are the services. Here are the references. There's a lot of different references scattered throughout. Here's my contact information at the bottom. If you ever want to know more in depth or to go over this again, or if you have any questions, because this is a lot of material, don't hesitate to reach out to me. I can either direct you where you need to go, I can offer suggestions. Please feel free really to reach out to me. If you need anything, if you want to get involved in advocacy on any of these waivers or any other advocacy opportunity, please feel free to reach out to me.
Thank you so much, Jennifer, for preparing all of this. I know it's